is up, gang? It's Shay. Welcome back to the channel where we talk about beauty, nursing, and lifestyle weekly. I am here to give you guys a gem today in the nursing community. I want to talk to you guys about how to study for these hard classes. And one class in particular I'm going to focus on today is pharmacology. I know typically when these videos are done, they generalize pharm, patho, A&P, they put it together and they tell you what you got to do. But I think I really want to sit down and take the time not only to break down to you guys what I think would be beneficial, but also how I did it personally, because I feel like some of the tips might really help you guys as well. So if you're interested, we'll go over some generic things, and I'll even give you guys towards the end of the video a sneak peek at some undergrad things that I did to pass pharm. So if you're interested, make sure you stay tuned and let's jump in. Alright guys, so the first thing we're going to talk about is getting a set study schedule. I know you guys are like, Shay, I've heard this a million times, I don't need to hear it, but let me just be brief with you guys. If you cannot get a Monday through Sunday, like Monday I study, Tuesday I go to this class, Wednesday I go to this class, Thursday I go to clinical, a set schedule like that, at least make sure you block out your study time in your planner. You really need to do this. For every hour of class you have, you should have 2 to 3 hours of studying. That's just my opinion. Every hour. So if you have a class for 3 hours in a week, you should be studying at minimum 6 to 9 hours for that content. And I know that sounds crazy. I think schools might say a little less, but I really feel like especially for pharm, it's content heavy. And people think pharm is just knowing drugs and knowing what they do and going to sleep. No. You need to know these drugs, especially as a nurse. I hate when people say, I'm only the nurse, I don't need to know all that. Your license is on the line when you give someone a medication and you don't know what side effects to look for after taking that medication. Your license is on the line if you know your patient is on one medication and you administer something else, knowing that you learned in pharmacology as a nurse that those two drugs don't mix. So it's not something that is to be played with, y'all. It's serious. And it's a team effort. You're taking care of a life. You have to make sure this is something that you're studying. And when you're studying it, it's not only to remember it, it's to apply it. So that goes right into my second point, which talks about what you need to know in pharmacology. So like I told you guys, people want to, say beta blocker is to control blood pressure and heart rate. They want to say, oh, psych med is for depression, but it helps to go beyond the mechanism of action. While the mechanism of action is important because it will help you pan out adverse and side effects, it is not the only thing you need to know. You need to know those adverse and side effects. So I do tell people, start off with the mechanism of action, but the mechanism of action is not just what the drug does. Example, like I just said, I'm not saying, okay, a beta blocker controls heart rate and blood pressure. What does it do? It goes to that receptor. It blocks that receptor. What does that receptor originally do when it's not blocked? It makes the heart rate go. So that's an example. And then you can even slide to the side effects and see what are the side effects. It dips the blood pressure down, dips the heart rate down. People get dizzy, people get tired. Why do people get dizzy and tired? Because their heart rate is going down. You have to make those inferences. Another one that a lot of people sleep on, another drug I talk about, Flomax or tamsulosin. It's an alpha-1 blocker. People don't know that alpha-1 is not only the bladder, neck, and things that are associated with the prostate, but you also have smooth vascular tissue that is being blocked. So when that occurs, it's not only, okay, this is helping people with BPH or benign prostate hyperplasia, it's also, a lot of my colleagues don't know, a side effect is somebody is going to get hypotension, or at least orthostatic hypotension. We see people in the hospital all the time and they're like, why are they dizzy? Why are they tired? Why do they have orthostatic hypotension? Well, I know it's not a major thing, but do you know that this is one of the adverse effects? This is one of the side effects. Sometimes you have to dissect it. It's not just understanding what this medication treats, but sometimes by knowing the mechanism of action in general, it helps you conclude on the side effects and the adverse effects. So if you see a question on a test that says, what is something you might expect from a patient that's on Flomax, you can say, okay, alpha blocker, not only bladder and neck smooth muscle, but also vascular smooth muscle. Okay, these are the options. I'm going to choose this. So that's as easy as it makes it with pharm. Another thing I also tell people when they're studying for pharmacology and when they're looking at the side effects, there are a ton. The first thing you need to do is weed out the side effects that cover for every freaking drug you take. Every single drug you're going to hear them say, nausea, vomiting, diarrhea. That's going to be the general concept for every medication, because half these medications are going through your GI tract anyway, to be honest. They're going to cause some GI irritation. For some people they might not experience that much, but you need to dip those out and start focusing on other things. So like, okay, is this causing agranulocytosis? That is something you need to highlight. That is something that other drugs you look at are not going to cause that side effect. Is it causing Stevens-Johnson syndrome? You need to highlight that, because that's something that other medications aren't really causing. Another good thing for, as I told you guys, mechanism of action and side effects. One big category that this does count for is the central nervous system and the autonomic nervous system. When you learn those drugs, make sure you pay attention to their mechanism of actions and the things they do physiologic, because those will come back. You will see in those side effects, tachycardia over and over again, dry mouth over and over again, unable to urinate over and over again, because they're all in the same class. And that goes into my next point. When you guys study these drugs, I'm like, I need to bring it down like 5 notches because I'm just so passionate right now. When you guys study these drugs, do not study them one by one. Don't study metoprolol, propranolol, lisinopril. Don't study them one by one. Study them by drug class. So like all those olols are beta blockers. Combine them. And then if there's one specific one that causes something, like I remember propranolol is not always very selective, then that's just something I remember about that one particular one. But for all those drugs, class them and then go over mechanism of action, side effects, adverse effects, and who these medications can and can't be given to. Same thing I just mentioned, lisinopril. That is an ACE inhibitor. There's tons of medications under that category. Catapril, what else? Ensidopril. They're all dash prils. So you will notice that in your drug classes, they're dash and they have endings. Categorize them and then talk about their mechanism of actions, their adverse effects, their side effects, and who they can and cannot be given to. So those are the ways you got to categorize those drugs. Hypertension drugs are great to talk about that because there's a lot of them, but when you combine them and categorize them, you can learn what you need to know. Same thing for asthma and respiratory drugs. Your long-acting beta agonist, your short-acting beta agonist, a lot of them are similar, like they have similar endings, so you can classify them, talk about their mechanism of action, side effect, adverse effects, who they can be given to and who they can't be given to. Okay guys, so the next thing we're going to talk about is sayings and acronyms and resources. So you guys know I'm a big advocate for Picmonic. I will tell you all day, every day. If you're audio, if you're visual, or if you're an audio-visual learner, Picmonic is a great way to go. I wish I had this at the beginning of my nursing program as a nursing student, because I would have popped all them classes like it was nothing. Because that's the way I learn. The repetitive seeing, the repetitive doing, the pictures. It just breaks everything down to make it simpler for you. Another very important thing I tell people when they're studying pharmacology is when you're trying to learn side effects and things like that, think of cute sayings or think of acronyms. If you can't get these on your own, go to YouTube, go to Google. It will help you. Some of the nervous system drugs, side effects, I will give y'all one. Can't see, can't pee, can't spit, can't shit, tachycardia. I remember that from undergrad into grad. I remember I was taking a test on some nervous system drugs. It was like, what is a side effect of blah, blah, blah. I'm like, okay, this is a nervous system drug. Okay, constipation. Okay, can't pee. Okay, dry mouth. Like, those are all things, they will stick with you guys. I learned that how long ago? In 2015, and it's 2020, and I can still say that off the top of my head. So it's very important, not even for just pharm, but even other classes. Anatomy, trying to learn stuff, make up sayings and make up little, quirky things. I remember cranial nerves. I will tell y'all what I learned on here, but I think it's a little inappropriate. Maybe I'll put it in the description box below. But those acronyms and those sayings, don't be afraid to, and I don't want to say dumb down, but don't be afraid to simplify your learning technique or simplify the way. Sometimes you need that little funny saying. Sometimes you need that little kindergarten song. These are the things that you need to help you not only to memorize, but also to apply what the stuff is. There will be some memorization at times, but it's stuff that's going to stick with you through. And if you can go back and, you know, say, okay, mechanism of action, and this is what the drug actually does, that's why people can't see, can't pee, can't spit, and have tachycardia. So there you go. Okay, guys, last thing I want to tell you for pharm is practice questions, practice questions, practice questions. When you get to pharm, a lot of people are real discombobulated off their first exam because they think it's going to say, what does this drug do? What does that drug do? What is a side effect? These are preparing you to take your NCLEX or to take your boards. So they're going to give you case studies. They're going to give you 29-year-old female that's taking this. They're going to give you 50-year-old pop-pop who's taking that. You need to take that stuff into consideration, and that's why practice questions are good. Literally go on Google and type in NCLEX pharm questions, or you can literally, if you have like a book, you guys know I talk about Saunders. I love Saunders. Go to those books and do the practice questions. If you have a textbook that comes with an online resource, do those questions. Even if they're not the exact same questions you're going to get on the test, they're going to get your mind in prepared to see these questions and know how to dissect them and know how to do the process of elimination. Anytime you get a multiple choice question, you should at least be able to eliminate 2 of them. That is my golden ticket. I always tell people, if you cannot eliminate 2 of those answers, you did not study that content enough to even take that particular question on your test. So just practice questions, practice questions, practice questions. You're not just going to be, you can write out your notes, you can write out your flashcards, you can learn these acronyms, you can look at these mnemonics, but if you're not doing the questions, your mind is not programmed or prepared for what you're going to see on the exam. But at least if you do the practice questions, you get, it's kind of like test driving the vehicle before you know, buy it. And that's what you're doing when you're doing practice questions. Alright guys, at this time, I'm going to try to go in and actually screen record, so I can show you guys one of the charts that I actually use. I know some people ask me, how did I get through pharm? So when I did pharm, I did charts, and that was undergrad. I did charts because charts were just easy. I told you guys I'm audio visual, so looking at the chart, I was able to break down them into sections. Like I told you guys, I was able to break down into adverse side effects, into all that other stuff, and actually get it done. So let me go ahead and screen record and bring this up, and then we'll talk some more. Okay, so what I've brought you guys to is a chart from back in 2015 when I was studying pharm, a respiratory chart, or respiratory medications. So as you guys can see, in the first column, I have listed what is the drug class. So what are those drugs known for? And then in the second column, what have I talked about is what their mechanism of action is. In the third column, I actually take the time to actually just make it layman's term and say what the drug is. I know I told you guys in the beginning of the video you don't just want to know what it is, but sometimes you just need that layman term. It's for asthma, period. It's for preventive asthma, period. It's for COPD, period. So that's what I did in the third. In the fourth column, if you guys look, I also put down some stuff that was just important for when administering. This should have included adverse side effects and side effects. I think I do have that in most of these columns. And of course, you guys see in my last column is all the drugs under that class. So like for the LTRAs, you see like the Montelukast, the Zaferlukast. You notice those Lucas endings that go in that category. Your corticosteroids, they're very easy because they're all loans or just all owns. Prednisolone, prednisone, dexamethasone, methylprednisone, things like that. Your LABAs or your long-acting beta agonists, you guys already know about the OLAs for like beta blockers. So beta agonists also have those all endings. And then this is another instance where I'm talking to you guys, like if you guys look at albuterols, which are under the short-acting inhaled beta agonists, what are one of the side effects? Tachycardia. Well, why would that be? Obviously because it is a beta agonist, so it has no potential like activity. Instead of being an antagonist, which will make it an exact blocker, it's an agonist, so it just sits on the receptor site. So you're still gonna have that high heart rate as a side effect from taking albuterol, tachycardiness, because if you look at the mechanism of action, that's why. it sits on the beta receptor in the same fashion. It does not change it and it does not antagonize it. So these are just little things that I wanted to show you guys off of my chart. Like I said, this was very generic. I was an undergrad. This was 2015, so it's not up to par with like everything, but this is just a good example. Okay, I'm back. So one thing I also want to tell you guys is how I would study too, is what I would do with these charts is I would delete certain parts of the chart so I could actually go back in and reapply it. So what I would do is I would like erase certain things, like either erase what the drug class was, or erase what the side effects were, or erase what the mechanism of action was, or erase what the different drugs included in the class were, and then I would print the chart, and it would be kind of like a fill in the blank thing. So I would take my time and I would go with the written chart and I'll be like, okay, this says it's a LTRA and I see there's no drugs, drug examples. What are some drug examples? I can write in Zaferlucas, I can write in Montelukas, things like that. Oh, I see for my oral corticosteroids, there's no mechanism of action. I can write in anti-inflammatory properties. So that was just another good way for me to study. Along with me, I also did practice questions and I did use registered nurse RN when I was in undergrad. Alright guys, I think we have reached the end of the video. I really want to thank you guys for sitting down and taking the time to discuss with me how to study for one of the hard classes in nursing school called pharmacology. For some odd reason, I have a little bit of a passion for pharm, and I think that's just basically because I worked as a pharm tech, so I was able to actually get additional information from like the pharmacists I worked with while I was in school, and actually seeing the drugs and knowing like if a patient calls on the phone, hey, I'm taking this medicine and I start feeling like this. Sometimes, even though we defer it to the pharmacist, I was able to say, oh yeah, this is a side effect and this is why, and I could process it in my head before I let the pharmacist talk to the patient. So I just want to thank you guys so much for taking the time to sit down with me today. If you are new here, make sure you subscribe. If you want to see more videos like this, make sure you guys let me know. I do want to do one for patho and A&P, but if you guys think that this video took care of enough and you don't want to see any more, then if I don't see any information or comments, I won't go any further. But anywho, thanks for watching. Make sure you subscribe, thumbs up, like, comment, and I will see you guys in the next upload.